Certainly we are all still in the holiday spirit, but probably most of us are looking ahead to 2020 and hoping to get those New Year's resolutions to stick this year. And if getting healthier in the new year is on your to-do list, you are in luck this morning. Amber Smith is a nurse practitioner with CHI Memorial Integrative Medicine Associates. Good to see you.
Hello, nice to be here.
So the practice long-standing, but the exciting news for you heading into the new year, you have a new location.
We do.
Up on Signal. So where are you on the mountain exactly?
Right beside Pruitt's.
Okay. So people hear integrative medicine, Amber, and I'm not sure they quite know what that means. What are you exactly integrating? But as my understanding is that once you're in the office, then you've got within that one office all of these different practitioners who can help you achieve your health goals.
That's correct. We take a very holistic approach. We have 5 primary care providers, so there would be like your PCP, your general practitioner, and then we have a deep tissue massage therapist, an acupuncturist, a nutritionist, a hormone replacement nurse, and 2 therapists on staff.
Okay, so the fact that you have this within an office that is part of Memorial Hospital, is this something then that insurance is now recognizing as being beneficial as well?
Absolutely. Insurance has decided that it's better to be proactive rather than reactive. So very much so. Even our acupuncturist is credentialed with most commercial insurances. We are still working on that, but it's a process.
Okay, so let's say that you're somebody watching and you do have a health goal in 2020, but you don't have anything diagnosed. You can't say, oh, I have arthritis, or oh, I have this. You just don't feel quite right. Would your office be a good place to come?
Absolutely. As the holistic approach goes, and the integrative piece, we do prescribe meds every day. However, if we can manage you with lifestyle modifications and supplement use, as well as our alternatives, we certainly do that.
When I was in high school, I passed out one day. I was a junior in high school and I was heading to a play practice and I just poof, passed out. So the principal of the school came and he ended up driving me home, but he said to me, well, Julie, do you have a lot going on? I said, no, Mr. McCollum, not at all. I'm just doing like getting to school at 7 and doing this and this, and I have a paper due and an AP class here. And you know, it was stupidly crazy, my life, but my initial response was, no, it's not busy. Do most of us have that same issue today?
That is a big problem, and we manifest our stress very differently, and for some people it would be an episode of passing out. Another, it's back pain or stomach issues. Absolutely.
So I would be a person who would think, well, when I go to the doctor, I need to be able to tell them what my problem is. Your office sounds like a place where the staff is trained to ask me certain questions to figure out what my problem is.
We pull from a lot of different places. Our intake paperwork is almost 20 pages.
Really?
If that tells you anything, yes. It's not your typical 2 or 3 pages for a new provider.
Okay, so some people too might hear you talk about lifestyle changes. That's easier said than done.
Yes, it is.
So as part of the makeup of the practice to help it be achievable for people.
Absolutely. Our goal is to help you be the healthiest person you can be.
Okay, acupuncture.
Yep.
It's not painful. I've had it done.
No, not at all.
And it's used for all different types of things.
Yes, Avaliza can treat most everything that we treat with Western medicine, with acupuncture and Eastern Chinese medicine.
Is it something where you need, and I'm making you wear a hat that might not belong on your head, but do you have to do it repetitively to get the full benefits, or do people notice it pretty quickly?
Most people have a benefit with the first visit with her. However, she does do a goal where she has her intake, which is like an hour and a half, and then you get like an hour-long session.
Right.
And then she creates a plan. So depending on whatever your problem is, be it anxiety, insomnia, back pain, whatever she's treating, she gives you a program that she's going to follow. Sometimes that's weekly, sometimes it's every other week, until she gets you to a maintenance.
Okay, and if you are somebody who currently is taking a lot of medications and you're wanting to wean yourself off of them, no doctor would advise you to do that cold turkey.
No.
but you have the doctors who can then facilitate getting you off of some of those medications.
Absolutely.
That's the ultimate goal, I guess.
The ultimate goal.
Okay, before I let you run, the deep tissue massage, that sounds really nice right
is.
about now.
Yes, very much
What
so.
types of health benefits, though, do people find with that?
Oh, Tim, he kind of thinks outside the box too, as far as that goes. He's not just a massage therapist. I have had patients that he's treated for TMJ.
Really?
He treats other things as well, but if you've got a nagging place in your back, he's your guy too.
So your practice is really one that, I mean, it's for everybody.
Absolutely. And we're family practice, so we see, children all the way up. They don't necessarily go to our alternatives,
Right.
but the primary care providers absolutely do see children.
And you know what, before I let you run then on that one, that triggers a whole nother thought. We used to live in a time where we all did have a family doctor. So the doctor got to know trends in the family, or hey, you had that such and such incident that happened last year, that might be why little Johnny's having this problem now. That's what we're going to find.
Absolutely.
Okay, so it's a self-referred practice, right? People can just call and make an appointment?
And then, we do have other providers or specialists that will send patients our way as well.
Okay, so how nice to have it be the one-stop shop for pretty much all of your healthcare needs, and then they are within the Memorial system. So if you need a specialist not in their office, of course, they can refer you from there. So 2 locations. The original one on Main Street, 643-2246 is that phone number. But they do now have the new location up on Signal Mountain, right next to Pruitt's. Then you can go pick out your healthy foods to get you on that New Year's resolution plan. 886-2004 is that phone number, and you can find more online at chimemorialmedicalgroup.org. Thank you.
Thank you so much.